Every single day, patients over 60 walk into my office dehydrated, not because they don't drink water. They drink plenty. Some of them carry a bottle everywhere they go. They track their glasses. They do everything they've been told, and they are still dehydrated. The blood work shows it. The skin turgor shows it. The viscosity of their blood shows it. The problem is not how much water they drink. The problem is that their body can no longer use plain water the way it did at 30 or 40. After 60, plain water passes through your system too fast. It floods the stomach, dilutes the electrolytes your cells need to function, triggers your kidneys to flush it out, and barely reaches the tissues that are quietly starving for it, your blood vessels, your muscles, your brain. You drink a full glass and 40 minutes later, it's in your bladder. Your cells never saw it. What you're about to hear is something most physicians will never walk you through at an appointment. There's no prescription to write for it. There's no procedure to bill for. But it may be more important than half the medications sitting in your cabinet right now. After 60, hydration is no longer about volume. It is about absorption. And one simple change to how you prepare your water can measurably change how your blood moves through your body. Let me explain why. Your body after 60 is not the body you had at 35. Several things have changed quietly in the background, and every one of them affects how water moves through your system. The first change is in your kidneys. Your glomerular filtration rate, that is the speed at which your kidneys filter blood and produce urine, declines steadily with age. But here is what makes it worse. Your kidneys still clear plain water efficiently, too efficiently. Water comes in, the kidneys process it, and it's gone before your intestines and your tissues had time to absorb what they needed. You are essentially pouring water through a system with a drain that's open too wide. The second change is in your brain, specifically in a region called the hypothalamus, which controls your sense of thirst. After 60, that sensor becomes less sensitive. By the time your brain finally tells you I'm thirsty, your body is already meaningfully dehydrated. You've already been running on thick, sluggish blood for hours without knowing it. The third change is in your blood vessels. The walls lose elasticity. The endothelium, that microscopically thin inner lining of every artery, becomes thinner and more fragile. When your blood is even mildly dehydrated, it becomes viscous. Viscous means thick and sticky. Your heart has to generate more force to push that heavy blood through vessels that no longer flex the way they used to. That is the direct connection between how you drink water and how your blood flows. And that connection has a name most people have never been told to think about: blood viscosity. It drives cardiovascular risk every single day, and almost nobody is talking about it. Now let me tell you what thick blood actually does inside your body, because this is where it gets serious. When blood viscosity rises, your heart has to work harder with every single beat. Not dramatically harder, not chest-clutching harder, just slightly, persistently harder. Hour after hour, day after day, year after year. That silent extra workload is how hearts wear out ahead of schedule. But the damage does not stop at the heart. When blood thickens, peripheral circulation drops. That means less blood reaching your legs, your feet, your hands, your brain. Oxygen delivery to tissues slows down. Carbon dioxide and metabolic waste products sit in your cells longer than they should. This is exactly why so many people over 60 have cold feet by evening. Why cuts and bruises take weeks to heal instead of days. Why your brain feels sharp at 8 in the morning and completely fogged over by 3 in the afternoon. Why your legs feel heavy and tired after doing almost nothing. People blame all of this on age. Doctors chart it as normal decline, but in a significant number of cases, the underlying driver is blood that is simply too thick. And the most common reason it is too thick is not a clotting disorder. It is not a genetic condition. It is chronic, low-grade dehydration, not collapsing in the desert dehydration. The quiet kind, the kind where you drink water every day, you never feel particularly thirsty, and yet your tissues are perpetually undersupplied. Clinical data ties even mild chronic dehydration to increased risk of stroke and heart attack, particularly in adults over 60. Your blood is almost certainly thicker right now than it needs to be, and you have no idea, because nobody ever measured it and nobody ever told you to think about it. Until now. Here is the part you came for. The fix is not complicated. It is not expensive. It does not require a prescription. But it does require that you stop drinking plain water the way you have been drinking it your entire life. When you add a small, precise amount of natural mineral salt, not processed table salt, and a squeeze of fresh lemon or lime to a glass of water, you fundamentally change how your body absorbs that water. Here is the physiology. Your intestinal lining does not absorb plain water passively. It uses active transport. Sodium and potassium create what is called an osmotic gradient across the intestinal wall. Think of it as a pull mechanism. When the right concentration of sodium is present in the water you drink, your intestinal cells actively pull that water into the bloodstream rather than letting it rush through to the kidneys untouched. This is not a wellness trend. This is the exact science behind oral rehydration solutions used in hospitals and emergency rooms around the world. The same principle that saves lives during severe dehydration works at a smaller scale every single day in your kitchen. The recipe is simple. 1 glass of water, a small pinch of unrefined mineral salt, Himalayan or Celtic sea salt works well. A squeeze of half a lemon or lime which adds potassium and citrate, optionally half a teaspoon of raw honey. The glucose in honey activates a co-transport protein in the intestine called SGLT1 that carries sodium and water together directly into your blood. Every ingredient has a job at the cellular level. This is applied physiology, not a fad, and the difference in blood flow can be measurable within 30 minutes. Now let me tell you what this means for your heart. Because this is the part that should concern you. When your blood is chronically even slightly too thick, your heart does not get to take a break. It compensates. It beats faster to maintain circulation. It squeezes harder to push viscous blood through narrowing, stiffening arteries. Your blood pressure rises, not because of stress or genetics or too much salt, but because the fluid in your system is too dense for your vessels to handle at normal pressure. Over weeks and months and years, that sustained extra workload takes a physical toll on the heart muscle itself, the left ventricle. The chamber that does the heavy lifting of pumping blood to your entire body begins to strain, the walls thicken, efficiency drops. This is how early-stage heart failure begins, not with a dramatic event, but with a slow, grinding overload that nobody connects to a water glass. Here is something I wish more physicians told their patients. A meaningful number of people diagnosed with early-stage hypertension are not suffering from a blood pressure disease. They are chronically underhydrated. Their blood is too thick, their vessels are working too hard, and the reading on the cuff reflects that. Proper hydration alone, real hydration that reaches the bloodstream, can reduce resting blood pressure by a measurable margin. And there is one more thing. Thick blood clots more easily. Platelets in viscous blood collide more frequently, stick together more readily. If you already have vascular plaque, if you sit for long periods, if your circulation is sluggish, elevated blood viscosity raises your risk of a clot forming in exactly the wrong place. A brain artery, a coronary artery, that is not a distant theoretical risk. That is a daily reality for millions of people who have no idea their hydration is part of the equation. You just heard something that most people never learn in a standard office visit, that the way you drink water directly affects your heart's workload and your stroke risk. Most viewers will watch this, feel concerned, and go back to their day, but you do not have to be most people. You can actually take a step right now. Care Health is a free platform that connects you with cardiac screenings, blood pressure monitoring programs, and clinical trials for heart disease and circulation, all in your area. You fill in a short form, date of birth, gender, basic information. Takes about 30 seconds. No cost, no commitment. Care Health matches you with options that are relevant to you personally. Click the link in the description or scan the QR code on screen. Just point your phone camera at it and tap the link that appears. As a physician, I would tell any patient exactly what I just told you, and then I would tell them to get screened. This is that step. Now let's talk about the mistakes that are making your dehydration worse without you realizing it. Because even people who drink water consistently every single day are making errors that sabotage absorption before the water ever reaches their blood. Mistake number 1, drinking too much at once. You sit down, pour a tall glass, drain it in 60 seconds, and feel accomplished. Your kidneys see a sudden flood of fluid and do exactly what they are designed to do, flush it. Most of that water bypasses your tissues entirely and ends up in your bladder within the hour. Hydration is not about big doses. It is about steady, small sips distributed across the day. Your intestines need time to absorb. Give them that time. Mistake number 2, relying on coffee and black tea as your main source of fluids. Caffeine is a mild diuretic. It signals your kidneys to excrete more water than the beverage delivered. You drink a cup of coffee and your net hydration moves backward, not forward. Coffee is not poison, but it is not water, and it cannot replace water. Mistake number 3, avoiding salt completely. This is one of the most damaging pieces of oversimplified advice in modern health culture. Yes, excess sodium is a problem. But without adequate sodium, water cannot cross from your intestines into your bloodstream efficiently. You drink and your cells stay dry because the osmotic gradient is missing. Mistake number 4, not accounting for your medications. Many of the most commonly prescribed drugs for blood pressure, cholesterol, and type 2 diabetes have diuretic effects. They increase water loss without any obvious signal. If nobody told you to increase your fluid intake when you started those prescriptions, you have been running at a deficit for months or years. Mistake number 5, waiting until you feel thirsty. After 60, your hypothalamus is unreliable. By the time thirst registers, your blood viscosity has already risen. Thirst is not an early warning system anymore. It is a late alarm, and by the time it sounds, the damage to your circulation has already been accumulating for hours. Now let me tell you about the most dangerous glass of water you are not drinking. Every single night, while you sleep for 7 or 8 hours, your body is losing fluid. You lose it through breathing. You lose it through perspiration, even if you do not feel yourself sweating. By the time your alarm goes off, your body has been running without a single drop of incoming water for the better part of a third of a day. Your blood viscosity is at its highest point of the entire 24-hour cycle, right when you open your eyes in the morning. This is not a coincidence. Clinical data shows that heart attacks and strokes occur disproportionately between 6 and 10 in the morning. That is the window when your blood is at its thickest, your platelets are at their stickiest, and your vessels are working their hardest. The first glass of water in the morning is arguably the most important glass you will drink all day, but here is what most people do. They get up, shuffle to the kitchen, gulp down a glass of plain water in 30 seconds, and immediately pour their coffee. That plain water hits the stomach, passes quickly into the intestines, and because there is no sodium gradient to pull it into the bloodstream, the kidneys clear it before your tissues ever benefit. You did the motion of hydrating. Your body did not receive the result. What I recommend to every patient over 60 is this. Before coffee, before breakfast, before anything else, prepare 1 glass of structured water, the pinch of mineral salt, the squeeze of lemon, and sip it slowly over 10 to 15 minutes. Not gulped, sipped. Give your intestines the time and the electrolyte balance they need to pull that water into your blood. That single habit, performed every morning, directly reduces the viscosity of your blood during the highest risk window of the day. No pill does this. No procedure does this. A glass of water prepared correctly does. Now, here is something you can check right now, today, without a doctor, without a lab, without spending a single dollar. Your urine is talking to you. The question is whether you know how to listen. Most people glance and flush. That is a missed opportunity, because the color of your urine is one of the most reliable, immediate indicators of how well your blood is hydrated at that moment. Here is what to look for. The target color is pale straw. Think light yellow, almost the color of diluted lemonade. That tells you your body has enough circulating fluid, your kidneys are filtering at a normal pace, and your electrolyte balance is in a reasonable range. If your urine is completely clear, like water, that is not a gold star. That means you are overhydrated. You are flushing out the very electrolytes your cells need to absorb and retain water. You are working against yourself. If your urine is dark amber, the color of apple juice or darker, that is significant dehydration. Your kidneys are concentrating everything they can because there is not enough water in the system. Your blood at that moment is thick, and your heart is working harder than it needs to. Here is what I see constantly in patients over 60. They wake up, use the bathroom, see dark amber urine, and think nothing of it. That is just morning urine. Everybody has that. It is common. It is not normal. It means you went to bed underhydrated, and your blood spent the entire night thicker than it should have been. Right through that high-risk cardiac window we just talked about. Here is your free diagnostic tool. Check the color 3 times a day, morning, midday, and evening. If it is consistently darker than pale straw at any of those checkpoints, your hydration strategy is not working. Something needs to change. You now know exactly what that change looks like. Now I want to shift your attention from what you drink to what you eat, because some of the most effective hydration you can get does not come from a glass at all. It comes from your plate. When you eat a cucumber, a stalk of celery, a slice of watermelon, you are not just eating food. You are consuming water that is trapped inside the cellular structure of that plant. This water is bound within a matrix of fiber, minerals, and natural electrolytes. Your intestines do not process it the way they process a gulp of liquid water. They break it down slowly, methodically, and the water is released gradually along with the very minerals your body needs to absorb it. Some researchers call this gel water or structured water. The concept is straightforward. Water inside a plant cell is not sloshing around freely. It is held in a semi-organized state by the cell's internal architecture. When that water reaches your intestinal lining, it absorbs more slowly and more completely than free liquid water from a bottle. Your body gets more of it. Your kidneys waste less of it. Cucumbers, celery, zucchini, oranges, berries, tomatoes, leafy greens. These are hydration tools disguised as food. Aim for at least 2 high water content foods at every meal, especially breakfast and lunch, when your hydration window is widest. Now contrast that with what many people over 60 actually eat. Bread, cheese, processed deli meats, crackers, cooked grains with very little moisture left in them. These are not neutral. They actively absorb water during digestion. Your body must pull fluid from its own reserves just to break them down. You eat a sandwich with cured meat and cheese for lunch, and your net hydration goes backward. You did not just fail to hydrate, you increased the demand on a system that was already running dry. The food on your plate is either helping your blood or thickening it. There is no middle ground. Here is something I tell every patient who starts taking hydration seriously. Water alone is only half the system. The other half is movement, and if you do one without the other, you are leaving the majority of the benefit on the table. Let me explain why. When you drink structured water correctly, your blood becomes thinner, more fluid, easier to circulate. That is real and measurable. But your heart is not the only pump in your body. It is the primary pump. Yes, it sends blood out through your arteries with every beat, but getting that blood back from your extremities, your feet, your calves, your lower legs, that is a different job entirely. Venous blood returning from your legs has to travel upward against gravity. Your heart alone cannot pull it back efficiently. It needs help. And that help comes from your calf muscles. Every time your calf contracts, it squeezes the deep veins in your lower leg and pushes blood upward toward the heart. Doctors call this the calf muscle pump. Some call it the second heart. When you sit for hours without moving, that pump is shut off. Blood pools, fluid seeps into the tissues, your legs swell, your circulation stalls. It does not matter how well hydrated your blood is if it is sitting in your ankles instead of circulating. The protocol is simple. After your morning glass of structured water, give it 15 to 20 minutes to absorb, then move. A 10 to 15 minute walk is ideal. If walking is difficult, stand and do calf raises. Rise onto your toes, lower your heels, repeat 20 to 30 times. That is enough to activate the pump. When properly hydrated blood meets an active muscle pump, peripheral circulation improves measurably. Cold feet warm up. That heavy, tired feeling in your legs by afternoon fades. Mental clarity sharpens because oxygenated blood is reaching your brain more efficiently. This is not theory. This is what patients report within the first week of combining both habits. Hydration and movement are a paired system. Start treating them as one. Here is exactly what I want you to do, starting tomorrow morning. Not a vague suggestion, a concrete, time-stamped protocol that you can follow without thinking. Morning. Within the first 15 minutes of opening your eyes, before coffee, before food, before anything, prepare 1 glass of structured water. Here is the recipe one more time. 1 full glass of water, roughly 250 milliliters, 1 small pinch of unrefined mineral salt, Himalayan pink salt or Celtic sea salt, about 1/8 of a teaspoon. A squeeze of half a lemon or half a lime. Optionally, half a teaspoon of raw honey. Stir it. Sip it slowly over 10 to 15 minutes. Do not gulp it. Your intestines need time, and they need that sodium gradient to pull the water into your bloodstream instead of flushing it straight to your kidneys. This is your highest impact glass of the day. It targets the exact window when your blood is at its thickest and your cardiac risk is at its peak. Mid-morning, around 10 to 11 o'clock, a second glass of structured water. Pair it with a high water content snack, a few slices of cucumber, an orange, a small bowl of berries. You are hydrating from 2 directions at once, the glass and the food. Lunch, drink water with your meal. Include hydrating vegetables, leafy greens, zucchini, tomatoes, celery. These deliver water in a fiber and mineral matrix your body absorbs far more efficiently than liquid from a glass alone. Afternoon, this is your final window for significant fluid intake. Finish your last full glass of water by 4 in the afternoon. After that, reduce to small sips only as needed. Large volumes of fluid in the evening load your kidneys at exactly the wrong time and disrupt your sleep. Evening, avoid alcohol. Avoid processed foods with hidden sodium, cheese, cured meats, sauces from a jar. These trigger overnight fluid retention and force your kidneys into emergency mode while you sleep. Before bed, if your mouth is dry, a few small sips, not a full glass, just enough to relieve the dryness. This entire protocol costs virtually nothing. No prescriptions, no supplements, no appointments. A bag of mineral salt lasts months. Lemons cost pennies. What it does require is consistency and the understanding that hydration after 60 is not about volume. It is about absorption. That is the root mechanism. Everything else follows from it. Let me bring this together. After 60, plain water is not enough. It was enough at 30. It was enough at 40. It is not enough now. Your kidneys clear it too fast. Your thirst mechanism fires too late. Your intestines lack the electrolyte gradient they need to pull water into your bloodstream where it actually matters. And while all of that is happening silently, your blood thickens. Your heart works harder. Your circulation to your legs, your hands, your brain slows down. Oxygen delivery drops. Clot risk rises. You feel it as cold feet, brain fog, heavy legs, sluggish healing, and a tiredness that sleep does not fix. You blame it on age. In many cases, it is not age. It is dehydration that nobody diagnosed because you were drinking water every day. You were just drinking it wrong. One small modification changes the physics. A pinch of unrefined mineral salt, a squeeze of lemon or lime, sipped slowly, not gulped. That is not a wellness trend from the internet. That is the same science hospitals use to rehydrate critically ill patients, applied to your kitchen every morning at a cost of almost nothing. Your body was designed to absorb water efficiently. It still can. You just have to give it the right conditions. Now you know exactly what those conditions are and exactly when to apply them. And remember, that free health screening link is in the description. 30 seconds could make a real difference for your heart and your circulation. Take care of yourself.